Hello, everybody. Thank you so much for tuning in today. This is the Bodega Cat Book Club Health Edition, and today we're continuing our reading of Never Be Sick Again by Raymond Francis. I hope you're enjoying this book so far. I know I am. I learn something new every time I read it. So, okay, today we will be reading chapter 10, and this is part 2. And I'm going to move the camera in a little bit so you guys can see. If you have a book, you can follow with us with your book. If not, you can follow with us here on the camera. Whichever way is more comfortable for you. All right, let's get going. Here we go. No ground to stand on. We are brought up to think of medicine as scientific in that the techniques and procedures used by our physicians are the result of extensive scientific study. Not so. Several studies, including a 1978 report by the U.S. Office of Technology Assessment, have estimated that no scientific basis exists for 80 to 90% of all procedures used in medical practice. In fact, traditional or allopathic medicine has no general theory of the organism, health, or disease, no unifying framework to tie it all together. Without a theory and a framework, there is no understanding of what the problems are, how they developed, or how to solve them, and everything becomes an ad hoc experience. The mechanistic manner in which medicine is practiced today has never been proven by scientific method. As Lynn McTaggart, author of the 1996 book, What Doctors Don't Tell You, wrote, for all the attempts to cloak medicine in the weighty manual, sorry, weighty mantle. Okay, let's try that again. For all the attempts to cloak medicine in the weighty mantle of science. Mm. A good deal of what we regard as standard medical practice today amounts to little more than 20th century voodoo. Doctors usually have little idea of what is wrong with their patients or how to make them well. And how can one blame them? They spent many years in medical school learning technicalities, procedures, and protocols, and were taught that cures must come from outside the body. That is why physicians have no faith or instruction about the natural capacity of the human body to heal itself. In fact, many argue that almost all conditions presented to physicians are self-limiting and spontaneously resolved by the natural healing process, regardless of what the physicians happens to prescribe. This natural healing process must become our focus because the magnitude of sickness in this country is astonishing. More than 3 out of 4 Americans now suffer from a diagnosable chronic disease, a dilemma that the modern medical establishment not only fails to solve but actually contributes to. Things must change. And this was written in what, 2000? Oh, what is that? 2002. Yeah, right. Things will change only if the consciousness of the people changes. Oh, sorry, a little squirrel there. In March 2001, the Institute of Medicine of the National Academy of Sciences issued a report titled Crossing the Quality Chasm, a New Health System for the 21st Century. According to this report, between the healthcare we now have and the healthcare we could have lies not just a gap, but a chasm. The report also said healthcare harms patients too frequently and routinely fails to deliver its potential benefits. The United States has the most expensive, yet one of the most inadequate healthcare systems in the world. Our infant mortality rate is worse than Cuba's. According to the World Health Organization, our overall health is worse than that of almost every European country, as well as Australia, Canada, and Israel. According to the above Institute of Medicine report, quote, a fundamental sweeping redesign of the entire healthcare system is required. The report cited that the nation's healthcare delivery system has fallen short in its ability to translate knowledge into practice and to apply new technology safely and appropriately. It went on to say, if the system cannot consistently deliver today's science and technology, it is even less prepared to respond to the extraordinary advances that surely will emerge during the coming decades. We've spent hundreds of billions of medical research dollars on outmoded science, which explains why we have not found the cause or the cure for a single chronic disease. Decades after President Richard Nixon declared, quote, war on cancer and other countless billions of dollars spent, malignancy survival rates are not noticeably improved. We have yet to produce a truly effective cancer treatment. Every minute, another American dies of cancer. Cancer is curable, by the way, on the physical aspect. The emotional and mental and spiritual aspect is and karmic aspect is a different story because they're all integrated. But the physical aspect, it I suppose it's probably pretty easy to reverse. That's just my opinion. Anyways, that's interesting because if the people as a collective, this is just a side note, if the people as a collective consciousness believe that cancer can be cured, then think about it. All the cancer clinics, cancer research, cancer nonprofits that's been raising money for all that, cancer doctors, uh, hospice uh, doctors, hospice, hospitals or whatever, all of that would be all gone. And that's what, 80% of the medical community? That's probably a little high, maybe 75. I don't know, I'm just throwing a number out there, but it would be amazing, wouldn't it? If as a collective consciousness, we believe that cancer doesn't exist or it can be minimized or it's not that big of a deal, right? Or it can be cured, that it's not a death sentence. All those uh, physicians will be out of a job. All the scientists would be cancer scientists would be out of a job. That's incredible. Wow. Which is why all the cancer industry is working very, very hard to keep us sick, right? Because they generate a lot of money. All about the money. All right, sorry about that. It was another little squirrel there. Where am I here? Ah, the situation is similar with heart disease. We can implant a new artificial heart surgically, but we cannot prevent or cure heart disease. Why? Because so few resources are devoted to study of the body's healing systems or to help patients understand and support their own health at the cellular level. Reallocating resources with these priorities in mind is the direction medicine must take if it is ever to be effective in reversing our epidemic of chronic disease. Everyone is unique. Interested only in identifying symptoms, physicians do not listen to their patients. Patients are regarded as machines, similar to every other machine. There's some truth in that in terms of seeing it as a machine, but it's only one part of the puzzle. I'm sorry, this is just another side note here. The machine analogy or the machine concept is just one little part or one little piece of the puzzle. There is some truth to that. But the human being is more than that. This is my opinion. So, anyways, doctors do not learn or need not learn anything unique about individual people. A study reported in the December 1993 issue of Internal Medicine News found that 70% of patients were interrupted by their doctor within 18 seconds after the patient began to describe their symptoms. As soon as the doctor has matched symptoms to a disease, treatments follow established protocols. Everyone with the same quote disease receives the same treatment. Oh, I had a thought about that, but skipped my mind. Oh well. Such procedures completely ignore one of the greatest scientific discoveries of the 20th century, biochemical individuality. Two people with the same so-called disease may need different treatments because no two people's cells are malfunctioning for exactly the same reasons. Modern medicine does not teach physicians how to recognize or work with each patient's unique biochemistry. Even when presented with scientific evidence that an alternative system works best, most physicians resist change and fail to apply these findings. Their disease based focus interferes with the essence of what healthcare should be, the optimization of health at the cellular level based on a person's unique biochemistry and life circumstances. Resistant to change. Adopting a more rational system of medicine would result in an enormous reduction in healthcare costs by eliminating hundreds of thousands of physicians and closing thousands of hospitals, not to mention the potential financial ruin of drug companies. Obviously, the economic incentive to maintain the status quo and not change is enormous. Currently, cancer is a $1 billion a day industry in the United States. That is incredible. $1 billion a day. It's not even a month or a year. It's a day. Wow. My mind is blown. And more people are employed in the AIDS industry than there are sufferers of AIDS. Modern medicine efforts to protect money and jobs were vividly described and documented in the 2000 book by former New York State Legislature Daniel Haley, Politics in Healing: The Suppression and Manipulation of American Medicine. Haley points out that in the 20th century, several inexpensive and highly effective cures for cancer were introduced in American medicine. The developers of these cures, well-meaning people, were native and believed that the world would welcome a cancer cure. With these people, among others, Harry Hoxsey, William Frederick Koch, Royal Raymond Rife, and Dr. Andrew Ivy, all fail to understand is that someone who threatens the survival of a prospering and growing industry with an inexpensive cure will not be welcomed. Oh, sorry. Make sure I got my right pages here. Um, Proven and effective cancer cures were repudiated and suppressed by the American Medical Association, AMA, yeah, and the U.S. Food, Drug, and Drug Administration, FDA, two of the biggest cartels, bullies, mafias. Discoverers of these cures were isolated, harassed, persecuted, prosecuted, financially ruined, and destroyed, and their treatments essentially have been lost. Some events described in Haley's book are bizarre and are hard to believe, yet they are documented by evidence presented at jury trials and recorded in court records. The FDA, AMA, the National Cancer Institute, and the American Cancer Society still continue to suppress cancer cures, such as that developed by Dr. Stanislaw Brzezinski. His office has been raided by FDA agents and U.S. Marshals. He has been persecuted relentlessly, and his medical license is on a 10-year probation, during which time he is not allowed to see new patients. These actions prevent public access to treatments and intimidate other unorthodox physicians. I think that's why there's a big movement currently to private membership associations. Because as a private member, that particular structure, anyways, is not within the purview of government licenses and, uh, policies and public stuff. Yeah. Mm. And it's usually all private paid, unfortunately. But anyways. Okay, physicians who have worked all their lives within the existing system often feel threatened by change. The majority of physicians support efforts by state medical boards and government regulatory boards to suppress alternative approaches. A less expensive, more effective way of practicing medicine threatens their economic well-being as well as philosophically questions the validity of their lifetime work. Physicians who have dared to introduce alternative treatments have had their licenses revoked, been financially ruined, and ostracized because they were willing to help patients with treatments that were not the quote accepted standard of care. A chilling example of how non-conforming doctors are kept in line is the case of Jonathan Wright, MD. On May 6, 1992, a small army of FDA agents plus 10 police officers with drawn guns and flak jackets attacked Dr. Wright's office. Rather than simply opening the office door and walking in, they broke it down, terrifying his staff and patients in the waiting room. Why? Was Wright on the FBI's list of known terrorists? No. Wright was merely an outspoken critic of modern medicine and the FDA, and he regularly used vitamins and natural substances in his practice. This approach to healing made him a target. During the 14-hour raid, all of Wright's records, equipment, manuals, vitamins, minerals, and herbs were confiscated. They even took his postage stamps. None of Wright's patients ever had complained about him. Wright was never charged with anything, nor ever prosecuted for anything. Yet both his practice and his reputation were damaged. It took years and hundreds of thousands of dollars in legal fees to have his patients' records returned and his practice restored. Events like this are not supposed to happen in America, but they do happen to doctors who step out of line. As a result, we are denied the right to choose certain treatments because our doctors cannot offer them. Most people are unaware that a physician can lose his or her license to practice by failing to adhere to quote prevailing standards of practice in their community. A loss of license can occur even if no patient is harmed, no patient has complained, and the condition of the patients involved actually improved. Physicians can learn something new at the medical conference or from a medical journal, but they cannot use it in their practice. The only treatments allowed are the ones already in use, which makes innovation and progress slow to almost impossible. Physicians must be very courageous to depart from traditional practices, even if they believe doing so can be helpful. Money is at stake, and competition from less expensive natural treatments is discouraged. The FDA is supposed to regulate drugs to assure that they're safe and effective. In practice, FDA approved, properly prescribed drugs kill about 400 people every day. Why? Because the FDA has become an instrument of the pharmaceutical companies, of the pharmaceutical companies. Yeah, they're in FDA is in the pharmaceutical company's payroll. They're bribed. Yeah, they're pretty dirty. The drug industry is among the most profitable in the world, and Americans pay more for the same drugs than people in other countries. To help protect these economic interests, about one half of the senior officials of the FDA formerly were employed as key executives in the drug industry. After leaving the FDA, about half eventually returned to executive positions in drug companies. Conflict of interest, anybody? This practice is termed, quote, the revolving door. The FDA is very biased in favor of drugs, and people are denied free access to the documented health benefits of nutritional supplements. Needless to say, these people are not in favor of treating diseases with vitamins. Both manufacturers and retailers of supplements have been subjected to FDA seizures and harassment. I was just thinking, wouldn't it be nice if everybody's healthy and nobody needs a doctor or not a doctor every day? All these doctors have all these free times to do what they like, right? Go on vacation, I don't know, gardening. I'd like that instead of working your butt off. I don't know. I'm just kind of weird that way, I guess. One of the supposed justifications for modern medicine's suppression of alternative approaches is that they have not been properly tested for safety and effectiveness. In truth, many alternative approaches, such as the use of vitamin supplements, are supported by thousands of sound studies, while ironically, up to 90% of the techniques and procedures used by modern medicine have never been proven to be safe or effective. Medical malpractice. A little side note, I wanted to become a doctor actually when I was trying to decide what to study in when I was graduating from high school. And I had two routes. One is nursing and one is MD, medical doctor. And I didn't want I and I chose nursing eventually because number one, I knew the medical practice, malpractice was crazy expensive. And number two, I wanted to be able to work right away. I didn't want to be in debt. Um, after your biology degree, 4 years biology degree or whatever it was, you still have like, I don't know, what is it, 8 years or 10 years before you actually graduate. Um, and I didn't want to do that. So I ended up choosing the nursing route and became a hospice nurse. So I was a hospice nurse for over 25 years. And now I don't have I was a registered nurse with a bachelor's degree, and now I don't have that license anymore. So, and it doesn't bother me because that doesn't define who I am. And people, as you grow spiritually, as you evolve as a person, and as you evolve mentally and emotionally, um, you kind of get to know who you are, and you're not defined anymore by your job, or at least that's the goal, anyways, right? Knowing who you are. Was it Socrates or Plato? One of those people said, know thyself, right? If you know who you are, then you're not defined by your job, even your kids, people you know. You're not defined by all that because they're all external um, things. I don't know why I went down that rabbit hole, but anyways, onward. Medical malpractice. According to a 1995 issue of the Journal of the American Medical Association, more than 1 million people per year are injured in hospitals, and 180,000 die from those injuries. Yeah, I think dying from prescription drugs is the third, or hospital visits or something like that, is the third cause of death. That is incredible. That just tells me that it's human error. Wow. And the insurance industry doesn't help either because, the doctor's like, insurance will pay for it. I'm not responsible. And that's not right. That is not right. Illnesses caused by prescription drugs are estimated to cost more than $136 billion a year. In 1981, study published in the New England Journal of Medicine concluded that at least one-third of hospital patients suffered some ill effect during their stay, and that 9% suffered major injury. Consider what the late Robert Mendelsohn, MD, author of the 1979 book Confessions of a Medical Heretic. 1979, this is how far back this started. That is just incredible. Wrote, I believe that more than 90% of modern medicine could disappear from the face of the earth. Doctors, hospital, drugs, and equipment, and the effect on our health would be immediate and beneficial. Wow, I'm clairvoyant. I just said that in the last segment. Anyways, normally one might think that if doctors went on strike, the public would suffer serious health problems. Yet, Mendelssohn noted cases when doctors went on strike and the and the death rate declined. In 1973, doctors were on strike in Israel for a month, and this coincided with a decline of 55% in the death rate. Wow, 55%. In 1976, a 52-day doctors' strike in Bogota, Colombia, coincided with a decline in mortality rate of 35%. That same year in Los Angeles, doctors staged a slowdown and the death rate dropped by 18%. In each case, when the doctors' labor actions ended, mortality rates shot back up to prior levels. In recent years, a number of medical journals such as Pediatrics, Lancet, Annual Review of Public Health, and particularly the July 26, 2000 Journal of the American Medical Association have been filled with statistics on injuries and deaths caused by modern medical practice. The most recent annual estimate of hospital cost death is 106,000 deaths from properly prescribed drugs, 80,000 deaths from hospital-caused infections, 12,000 deaths from unnecessary surgery, 7,000 deaths from medication errors, 20,000 deaths from other errors. And remember, this book was published in 2001, so that's pretty staggering. I bet the numbers are probably double, at least double, if not triple or quadruple by now, since it's been so long. 2001, that's about 40, wait, 2001, 2011, 10 years, 2021, more than, sorry, I'm really bad at math. Was it 20 some years? I get whatever it was. Anyways, these numbers total 225,000 deaths per year, but the real total is far greater. These numbers do not include unreported medically caused deaths. Why take responsibility for a death if another plausible explanation can be given? Even in good hospitals, only one adverse event out of four is reported. Some studies have placed the reporting as low as 1 out of 20. Medicine-caused deaths in outpatient settings have been estimated as an additional 200,000 per year. Again, this figure is conservative. Perhaps one of the biggest problems, though, is X-rays. Wow. The threat of X-rays. I have never, ever, 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 ever had a mammogram. Never, never. That's horrible what they do to the breast. Ugh. That's just inhumane, in my opinion. But, anyways, the threat of X-rays. One of the most serious threats to our health may be caused by one type of medical testing, medical and dental X-rays. There is no safe radiation level. Any amount of radiation can cause our cells to malfunction. The radiation levels from medical and dental X-rays, though supposedly within quote safe limits, contribute to help to both cancer and coronary heart disease. Just as another side note, this section or this book talks about the American Medical Association. It goes the same also goes for the Dental Association, the eye ophthalmology. Um, what else? Veterinary practices, um, things like that. They're all interrelated because it all stems from the American Medical Association. So whatever it is they're doing to the human, uh, they're also doing it to the animals. So food for thought. Anyways, mm, okay. The radiation. Oh, another side note. I have a lot of thoughts going through my mind today. I've been kind of going down different rabbit holes of trying to find holistic veterinary stuff. If any of you have any books you want the book club to read about holistic vet practices or doctors or whatever, put it in the description box below. Or if you have any resources, let me know and I'll share it with our community. So, anyways, um, just wanted to share that real quick. Okay, the radiation levels from medical and dental x-rays, though supposedly within safe limits, contribute to both cancer and coronary heart disease. Evidence was published in 1999 by John Goffman, a medical doctor and a PhD nuclear physicist, who is one of the world's leading authorities on radiation damage. Dr. Goffman's book, Radiation for Medical Procedures in the Pathogenesis of Cancer and Ischemic Heart Disease, presents a compelling argument for reconsidering how we understand disease and death rates in our society and modern medicine's responsibility for them. Goffman's research caused him to conclude that medical radiation was probably the single largest cause of cancer mortality in the 20th century. Goffman's evidence suggests that medical x-rays are a necessary cofactor, meaning that while other factors are involved, the x-ray is necessary for both cancer and heart disease to develop. Dr. Goffman found that more than 60% of deaths from cancer and more than 70% of deaths from coronary heart disease involved x-rays. To cite just one example, Kaufman found that in 1990, medical x-rays were a necessary causal factor in 83% of all breast cancer. In other words, chest x-rays and mammograms are the leading cause of breast cancer. And breast cancer can also occur in males, not just females. I had a patient many years ago who was a male who had breast cancer. I don't know what caused it. I don't remember, but he was a guy who had breast cancer. So fortunately, thermography is a safe and effective alternative to mammograms. Thermography measures temperature and appears to be a far more accurate way of detecting tumors at a much earlier age. A cancerous tumor, as it begins to receive its own blood supply, is warmer than the surrounding tissue and can be discerned when the temperature of the breast is measured. Modern medicine is responsible for about 90% of our exposure to man-made radiation, and about 90% of that exposure is the result of diagnostic x-rays. A level of radiation less than that produced by 10 by 2 by bite wing dental x-rays can produce thyroid cancer, and not surprisingly, an epidemic of thyroid cancer is now being found in people who had upper chest, neck, and head x-rays decades ago. Nevertheless, x-rays are performed with alarming frequency. Goffman estimates that more than half are not necessary. Other researchers have placed the percentage of x-rays of little to no medical value as high as 90%. Even low-level x-rays are capable of inflicting genetic damage, presenting a hazard to both existing and future generations. For example, correlations have been found between the number of abdominal x-rays a mother had received in her lifetime and the birth of a baby with Down's syndrome. Ah, that's very interesting. So I wonder if that goes with the ultrasound that they do with the babies. What was the other one that I was thinking of? Oh, MRIs and see, what was the other one? MRIs and There was another one. I forgot what it's called. I wonder if those are included in the radiation thing too. Hmm. Okay. The public worries about radiation from nuclear power plants, yet a more common hazard is radiation from medical X-rays. Decline X-rays unless they are absolutely necessary, which is not often. Children are especially vulnerable to radiation and need to be protected by their parents. Applying Dr. Goffman's data on medical x-rays to 60% of the deaths from cancer and 70% of the deaths from ischemic heart disease in this country, I calculated that x-rays cause about 650,000 deaths every year. Oh, CAT scan was the other one. CAT scan, MRI, and ultrasound. I wonder if they're all kind of lumped into the x-ray uh, category. Just wondering, I don't know. If anyone have any idea, let me know in the description box below or in the comment section. Uh, okay. Combining these deaths with the acknowledged number of medicine-caused deaths, 250,000 inpatient and 200,000 outpatient per year, reveals an estimated total of more than 1 million deaths per year caused by modern medical practice. This figure amounts to about half of all deaths in America, making modern medicine our leading cause of death. Should you have medical testing? Among the treatments that cause patients harm are diagnostic tests, everything from ultrasound to x-rays, from blood tests to barium enemas. Many of these tests are inaccurate, present more risk than benefit, and alternatives often are safer and more effective. The only time these tests are justified are when safety is clearly in question and only when the results of the test would require action. Avoid tests that simply provide information. For example, avoid ultrasounds during pregnancy, which, oh, well, that answers my question then, because I was wondering about the ultrasounds, which do little more than inform patients about their child's development and rarely lead to any meaningful action. Always question your doctor carefully about whether a particular medical test is necessary, especially if the test is invasive. All tests need not be avoided, but ask about potential risks as well as benefits. Be aware that most doctors downplay risks. Yeah, because they get kickbacks or money from it, or they get paid. Remember, a diagnostic test precipitated my own health crisis. Most often, doctors order tests to measure symptoms in order to make a diagnosis. Such testing is not especially useful because it is not designed to measure the causes of disease, deficiency, and toxicity. It only measures, a side note here, it only measures the symptoms. And a lot of times when the symptoms manifested, for example, like in lab work or x-rays or ultrasound, whatever it is, the damage has already been done internally. So, um, so anyways, food for thought. Hmm. Um, where am I? I'm just not. Let's try that. Let's try that paragraph again. Most often, doctors order tests to measure symptoms in order to make a diagnosis. Such testing is not especially useful because it is not designed to measure the causes of disease, deficiency, and toxicity. Doctors should be ordering tests that measure directly or indirectly levels of deficiency and toxicity and what is causing them. If the tests are not for these purposes, excuse me, I burped my coffee. They may be unnecessary. Many diagnostic tests are ordered solely for defensive purposes so that physicians can prove they considered every possibility in the event of legal action. Decline tests if the doctor is unable to explain how it will help to measure and correct your cellular deficiency and toxicity. Every invasive test poses some risk. Even a simple blood test poses the danger of an infection developing at a puncture site. Punctures for removal of fluid from the joints, bone, spinal column, and womb pose greater risks. Be especially wary of signing an informed consent for a diagnostic tip-off about the degree of risk involved. If the accuracy of test results seems questionable, seek a second opinion. Yeah, and second opinion, you want to do it outside the medical system because if you get a second opinion within the medical system, they're trained with from the same educational system, and so they're going to say the same thing. It's food for thought. Be skeptical of any diagnosis based solely on a test. If something is found abnormal and the doctor wants to prescribe, request to have the test repeated before doing something that could cause damage, be it needless surgery, biopsies, medications, anxiety, or financial costs. Suppose that a particular medical test is 95% accurate. For every 20 tests given, one false result will occur, usually a false positive. If a person has this test 20 times in a lifetime, the odds are in favor of at least one false result. In fact, many diseases can be cured simply by redoing the test. In 1975, the Centers for Disease Control and Prevention surveyed medical testing labs nationally and concluded that more than 25% of all test results were wrong. For certain clinical chemistry tests, the error rate was 50%. Not a lot has changed since then. A study in the May 1997 issue of Hippocrates, Hippocrates, this name stumps me. I know he's the father of medicine, but I'm always reminded of uh Hippocratic. No, that's not right. Hypocrisy, you know that word, hypocrisy, hypocrite. I kind of wanted to pronounce it that way. It's kind of a little brain twister there, but I think it's pronounced Hippocrates, Hippocrates, father of medicine. Hmm. Examined 169 different kinds of medical diagnostic tests and concluded that only 9 of them actually did anything for the patient for reducing the incidence of disease. According to the article, many of these tests regularly led to faulty diagnoses, resulting in unnecessary treatments the patients did not need, and people with passing chest or back pain were, quote, being marched off to surgery to get their hearts repaired or spines fixed. About 70% of all pregnant American women undergo ultrasound evaluations. Yet studies published in medical journals, including Lancet and the Canadian Medical Association Journal, show that ultrasound may affect fetal growth, resulting in babies with lower birth weight. In addition, children are twice as likely to have delayed speech development if they were examined via ultrasound as a fetus. A 1995 study done at the Massachusetts Institute of Technology and reported in Science found that low frequency ultrasound increases the permeability of human skin, allowing proteins to pass through more easily. Ultrasound definitely affects the body's tissues, yet it is presented to patients as a procedure free of risks and side effects. Wow. Okay, we'll stop here for now. I hope you enjoyed that. And sorry for all my side notes and thoughts and little rabbit holes and all that stuff. So, anyways, um, we will continue next week. In the meantime, I hope you guys check out our other book clubs. We have the spiritual book clubs on Mondays and financial book clubs Thursdays. And then, of course, the health book club every Wednesday. So you can check out all the links below, check out our website, and check out our center. And I hope you guys all have a great week and stay cool. I think it's gonna be a hot summer, another hot summer. So, all right, bye bye now.